Okay, so what we're going to do here today is we're going to go over a patient assessment of a conscious patient complaining of chest pain. So we get the call of a 58-year-old male complaining of chest pain. We arrive on scene. First thing we're going to do is, as we get out of the ambulance, we're going to survey the scene, make sure the scene is safe for my partner and I. We grab our equipment, we come up to the door, we knock on the door, they answer the door. Again, surveying the scene to make sure the scene is safe for my partner and I. As we gain entrance into the home, I walk up, I observe that I have one patient. The nature of illness, the NOI, is that the patient is complaining of chest pain. And additional resources are the resources I need to help me process the scene. So as I walk up to the patient, I'm going to form a general impression. And the impression I'm getting is that the patient is sitting up, they're sweating heavy, they're diaphoretic, that means sweating very heavily. They have pale skin and they're holding their chest and they're complaining of chest pain with difficulty breathing. So I come up, I introduce myself to the patient. I'm going to ask him his name, where he's at, what time it is, and what is going on. He tells me he has chest pain with difficulty breathing. Since he is answering all my questions and he is talking to me, I can determine that he has a patent. I can identify that as a patent airway, and I have no need to assist his airway. Okay, I'm going to have him sit up, because this is the best way to do it, is have him sit up a little bit and check his lung sounds from the back. That is the best location to check his lung sounds. Checking his lung sounds from the back, along the scapular line, and then come up to the front and check his midclavicular line. His lung sounds are clear bilateral. I determine that he's breathing at 16 breaths per minute. His O2 saturation, if it's 97% or better, we don't have to put him on oxygen. But if it's below 97%, our goal is to get him back up to that 97 or higher, so we would put him on oxygen. So as I check his SpO2 levels, let's say it's 96, we will then go and identify, let the patient know we're going to put him on a non-rebreather mask to help him breathe. So our B step is now done. Next thing I'm going to do, because he's conscious, I'm going to check his radial pulse. And what is his pulse? I get a pulse rate of, say, 100. I'm going to look up and down the body for any signs of profuse bleeding. I see no bleeding. And then I'm going to go ahead and check his skin vitals. I'm going to check his temperature. I'm going to look at his skin color. We have reported as pale. And his condition, he's diaphoretic, meaning he's sweating heavily. So now my ABCs are done. I've determined that I have a medical patient. This is going to be a rapid transport. For additional resources, I'm going to call advanced life support. Okay. Now we're going to go into our secondary. We're going to do our OPQRST mnemonic. So O, onset. When did this all start? And the patient tells me that he was sitting on the couch watching TV when his chest pain started. I'm going to ask him, does anything provoke it? P, and provocation. He says, no, it's a steady pain getting worse. Now I'm going to ask him the quality. Can you describe this discomfort that you're having? He describes it as a sharp pain. And I'm going to ask him for R. Does it radiate anywhere? He informs me that it's in his chest, going down his left arm, and to his jaw. And then the S, severity, on a scale of 1 to 10. Sir, on a scale of 1 to 10, 1 being no pain, 10 being your worst pain, can you give me a number? And he says it's about a 7. To clarify this a little bit more and give more information, you can ask him, has he had this type of chest pain before? Yes or no? And if he has, what was it like then compared to what it is today? So it gives that severity number that he's just gave me, gives it some value to it. Okay? And then the time is how long has this been going on? And he states it's been going on for about 45 minutes to an hour. Okay, so now my OPQRST is done. Next, I'm going to go ahead and go through my sample history. Well, we know the signs and symptoms. He's diaphoretic, pale, complaining of chest pain, and the chest pain is radiating to his jaw and down his left arm. So ample, we're going to go to allergies. Sir, do you have any allergies to any kind of medication, foods, insect, or environment, any kind of allergies? He says he has none that he knows of, okay? Now we're going to go into our medication phase. Medications. Do you take any medication prescribed to you by a doctor? And he says yes. He has nitro and Coumadin. Coumadin being a blood thinner. Okay? I'm going to ask him, have you taken any over-the-counter medications today? He states no. Have you taken any illicit drugs today? He states no. Any kind of herbs or anything like that that you use in your food and your drink? He says no. The only medication he's taken is the nitro and his Coumadin. So now that we understand that, sir, have you taken any nitro today since your chest pain started? He states that he has not. Have you taken your Coumadin or any kind of blood thinners today? He states no. So our M is done. We're going to go to P, past pertinent medical history. Can you tell about your medical history as far as chest pain or anything like that, or why you're on nitro? Tells us that he's had a heart attack 1 year ago and he's got angina. Excuse me. So at this point, we got his past medical history. What did you have to eat last? His L's last oral intake. Says he had lunch, a soup and a sandwich. And then the events, what were you doing when this all started? And he says that he's sitting on the couch watching TV when the chest pain started. So we got our OP-QST and we have our sample history completed. Next thing we're going to do is go ahead and do a set of vital signs. Check our 5 vital signs. First vital sign we're going to check is his blood pressure. What is his blood pressure? Then we're going to check his pulse rate. Okay. Then we're going to go ahead and repeat and listen to his lungs and get his respiratory rate. We're going to go ahead and repeat, assess his skin vitals. And then we're going to go ahead and check his pupils. And his pupils are pearl. His blood pressure, say he has a blood pressure of 160/90. His skin is pale, cool and clammy. His pupils are pearl and his respiratory rate is 16 with clear lung sounds bilaterally. And he's still on the non-rebreather mask. So now that we've completed our history taken, now we can step into our medicating the patient. At this point, I'm going to say, sir, have you taken any Coumadin again? Good, reassure, make sure that he hasn't taken any blood thinners. He assures me that he has taken none. We're going to take out our children's chewable aspirin. And we're going to say, we're going to check our aspirin, make sure that it's valid, not expired. We'll take it out. We're going to ask him, before I give you the chewable aspirin, do you have any bleeding disorders? And the patient states no. We're going to then make a statement that you have to say in the state exam that based on Mass State protocols and the patient's not having any allergies to the medication, to the aspirin, I can administer 324 milligrams of children's chewable aspirin. So I'm going to take the 4 tablets, have him put them in the cover, have him put them into his mouth and have him chew up the aspirin really good, and then swallow as he's crunched it all up. Now that the aspirin is on board, so we've got oxygen, you've given the aspirin. Next, we're going to go into our nitro. Since we do not carry the nitro on the ambulance, the nitro he's going to give to us. So we have his nitro. Again, we want to reassure, sir, have you taken any nitro today? He reassures us that he has not taken any. We're now going to go ahead and do the 6 R's. As I look at the container, the pill bottle, I'm going to make sure it's his medication. So make sure it's the right patient, the right medication, the right time to give it. He's having chest pain. The right dose, the right route, and the last one is the right documentation. Before I give him the nitro, I want to reassess. I want to double check his blood pressure, make sure his blood pressure systolic is above 200. Is above 120. 200 kind of high, but make sure his blood pressure is above 120. I'm going to ask him if he's taken any kind of Viagra or any kind of erectile dysfunctional medications within the past 48 hours. He states no. Okay, and I'm going to advise him that I'm going to give you the nitro. When I give you the nitro, you may get a slight headache. You're going to feel some tingling sensation underneath the tongue. That's just letting you know that the pill is dissolving. Before I go ahead and give it, I'm going to state that based on Mass State protocols, I can go ahead, standing orders, I can go ahead and give him 1 nitro with a max dose of 3. So we're going to take a nitro tablet, put it in the cover, have him lift his tongue, place it underneath his tongue, which is called sublingual, and then we're going to let it sit in his tongue as it dissolves. Now that we've medicated our patient, we want to package him up on the stretcher and let's get him out to the ambulance. Once we're in the ambulance, we're going to start our transport to the hospital, and we'll intercept with ALS en route. While we're transporting, I want to ask the patient if he has any kind of pain or discomfort anywhere in his body. Does he have a headache? Did he fall, bump his head, or anything like that? So I want to basically scan him head to toe for any possible injuries that he may have. If there are any kind of injuries, we would treat any secondary injuries that we find on the patient. At that point, I'm going to go reassess my mental status. I'm going to reassess my ABCs, airway, breathing, circulation. I would then go and reassess my vital signs and reassess my interventions, which would be the QRS, meaning that I'm going to ask him, sir, on the chest pain, you said it was a sharp chest pain. Can you describe your chest pain now? And now he tells me it's more of a dull ache. Okay, I'm going to ask him if it radiates. And he says at this point, it's just in his chest, slightly to his jaw, nothing to his left arm. So we know that the nitro has helped. And the severity, it was a 7 out of 10. Now on a scale of 1 to 10, 1 being no pain, 10 being the worst pain, where would your severity be now? And he claims it's about a 4. So at this point, I'm going to go ahead and reassess my vital signs once again: blood pressure, pulse, respiratory rate, skin vitals, and his pupils. I'm going to make sure that my blood pressure, my systolic blood pressure, is 120 or better. Okay, so he has a blood pressure of, say, 140 over 88. Okay, and he's got chest pain still of a 4 out of 10. So now we can go ahead, based on Mass State protocols, standing order, we can administer 1 more tablet sublingually. And then we're going to continue our transport, reassessing the patient every 5 minutes all the way to the hospital. And that will end, and that'll end the assessment of this, on this case.